Welcome. Thank you for joining us today for the webinar on cancer-related behavioral research through integrating existing data. Before introducing our moderator, who will review today's program, I'd like to provide a few tips for using WebEx so that you can get the most out of your experience. All attendees will be in listen mode only. Should you experience technical difficulties, such as not being able to hear, view the WebEx screen, or PowerPoint, then please contact us at any time using the chat panel and selecting host from the drop-down menu. If you need to view live captioning, please also see the chat panel. To submit your questions, type them into the Q&A panel and select all panelists from the drop-down menu to submit. We will ask them on your behalf during the Q&A portion of the presentation. I additionally want to make note that today's webinar is being recorded and will be posted online at a later date. And following today's webinar, you will be directed to a short 5-question survey. We encourage you to complete the survey to help us plan for our future events. With that, I will pass the presentation over to our moderator, Jerry Soles.
Good afternoon. Thanks for coming on and listening to this presentation. So first, just tell you who's in the room and who will be talking. I'm Jerry Soles. I'm the moderator. I'll be talking at the beginning. And I'm a senior scientist in the Behavioral Research Program at NCI. We'll say a little more about NCI and the Behavioral Research Program in a moment. The main speaker is Richard Moser, who's Program Director and Research Methods Coordinator at the Behavioral Research Program and the lead on this funding announcement. And Michelle Mollica is a Program Director in the Healthcare Delivery Research Program, and she's our technical expert. The goal here today will be to talk about, first, some background about NCI and the Behavioral Research Program to give you an idea of where your grant or your application will go and who will attend it, and also this will help you to understand who to contact about some of the details regarding these proposals. Then some details about the funding announcement. FOA, for those of you who don't know, stands for Funding Opportunity Announcement. So some details about that. Then there'll be discussion of the resources, and questions have already been posed on the net, and those will be answered by Rick and others here, depending on the nature of the question. So I think with that, we'll go on to the background, just to have a sense of where this funding opportunity announcement came from, who tends it, and where it's really located with regard to the National Cancer Institute. The Behavioral Research Program, from which this funding announcement came and was developed, is part of a larger division of the National Cancer Institute, the Division of Cancer Control and Population Sciences. There are 4 different research programs that comprise the Division of Cancer Control and Population Sciences, or DCCPS, the Healthcare Delivery Research Program, the Behavioral Research Program, the Epidemiology and Genomics Research Program, and the Surveillance Research Program. You can probably tell from most of the names the general issues that these different programs involve and the kinds of grants and contracts that they tend, lead, facilitate, etc. The Behavioral Research Program, or what we call BRP, is particularly interested in looking at the role that basic behavioral and psychological science plays with regard to research in understanding various topics, areas, questions, and challenges in cancer control. When we say cancer control, frequently we also add a phrase to that, another word to it, cancer control continuum, to try to talk about the various domains stretching all the way from prevention of cancer all the way through to treatment of cancer. We should also note, however, which might not be as apparent, in the BRP program, as well as a number of the other programs, we talk a lot about prevention, primary, secondary, and tertiary prevention. And by just simply saying that, if we're talking about cancer, then clearly there are things like tobacco use, diet and energy balance, and sun protection are some of the topics that are going to be considered and are considered by all 4 branches and most relevant for us today, the behavioral research program. So a little bit about how we fund grants. Although this might seem like, why do I want to know this if I haven't got a funded grant yet? In actuality, or maybe you do, but the fact is understanding how this works and what distinctions can be made among grant applications actually is very worthwhile information to have, we think. So first thing to note is that the behavioral research program, like most of the other programs in the Division of Cancer Control and Population Sciences, most of our portfolio, the grants that we hold, most of them are unsolicited, that is, investigator-initiated grants. The investigator has an idea, they write a grant proposing research to do that and to be supported, and that's the major way in which a lot of the work that we fund and we hold in our portfolio and tend, a lot of that is that. However, there are three notable sub-areas. One is requests for applications. These are called RFAs. When we talk about an RFA, we are talking about usually a funding announcement for a one-time solicitation of applications, which has a very specific receipt date. There is what are sometimes called set-aside or funds earmarked for this initiative. Sometimes that's referred to as set-aside money. And also the number of grants or awards that are likely to be funded are also limited to a particular number, depending on the topic. And then there's also particular criteria for scientific peer review. What are the standards to be held? What are the topics to be considered? And other criteria within the grant. If an application is received in response to a particular RFA, so this is an FOA or funding opportunity announcement that would specifically say RFA on it, then that will be reviewed by the Institute, that is NCI's scientific review group. You might say it's reviewed inside NCI. RFAs are much less frequent than the other two kinds of grants, or unsolicited R01s, which we'll talk about in a second. Program announcements, PAs, are announcements that specifically are interested in seeing particular kinds of topics covered. These kinds of grants, they're in response to an announcement that says we want to see something on, let's say, medical adherence or something like that. There will be a specific date on it. There will probably be numerous dates. Most PAs usually go for at least 3 years and may have receipt dates that'll be fairly standard in accord with other sorts of grants, probably 3 times a year, very likely. And these grants, the PAs, will be reviewed using standard peer review processes. What that means in almost all cases is if you respond to a PA, your grant will be submitted and it will go to the Center for Scientific Review, which is distinct from all of the ICs or institutes at NCI. It's all under NIH, but it's a distinct group that administers the review process. And so a PA grant, an application that is submitted in response to a PA will no doubt go to a standard peer review process, a standing section. The announcements we're talking about today are program announcements of the PAR kind. There's sometimes confusion about these because they can mean a number of different things. But we could say safely with regard to this PAR that number one, there's special receipt, which means special receipt dates. In fact, very likely, I believe, there will be 2 dates that these applications have deadlines for, and that will be for 3 years. Referral, that means they will be referred to a specific SRO, Scientific Review Officer, in the Center for Scientific Review, and there will be special review considerations. Why I say before there can sometimes be confusion about PARs is that sometimes a PAR may just have a special receipt date. That may be the only thing that makes it a PAR. In this case, however, this is going to be special receipt dates, special referral, and special review considerations. And what we mean by special review considerations is that because of the nature of this PAR and what it's looking at, it is viewed as one that merits getting review by special experts in the topics for which this FOA, this PAR, has been developed. And in this case, this has to do in large part with secondary or integrative data analysis and other kinds of issues. It's also related to cancer, so that's another consideration that would be taken into account in terms of forming a panel. In almost all cases in the PARs, this means that what is sometimes called a SEP, or a special emphasis panel, is convened, especially to do a review for these processes. That SEP could be bringing experts into NIH to do the review, into the Washington area or metropolitan area, et cetera. It could also possibly, depending on the number of applications, be done by phone, or it might be done by something called internet-assisted review, which involves the comments that most people who apply to NIH grants are aware of, where reviewers post their reviews, other reviewers see them. There is then a chat function over a period of 6 to 8 hours where these folks, the experts, exchange opinions, debate points, and then finally come to some kind of vote as they would in a normal study section. I think that pretty much covers most of the things about the PAR. There are two kinds of mechanisms that this PAR is relevant to, the R01 and the R21. The R21 is a research project grant. It supports a discrete, specified, circumscribed research project. It's the most commonly used grant program in NIH. There is no specific dollar limit. However, note the bullet point that if your grant in direct costs in any year exceeds $500,000, you need to get advance permission to do that. This could come up because you have a very expensive project, lots of a big team, some high subject costs, equipment costs, et cetera, et cetera. It could also be in excess of $500K because you have another university that has also engaged with you in this project, and as you may know, or should know now, you'll know, you need to consider their indirect costs as contributing to that $500K. So you need to get advance permission. You should definitely talk to Dr. Moser about that topic. If you think that's going to be true, then you're asked about 6 to 8 weeks before the receipt date to submit a document which provides information and justification for this that he will need to get approval for if it's over $500K in any 1 year. Finally, R01s go from 3 to 5 years. That's the applicant's choice based on what work needs to be done. An R21 is an exploratory developmental grant. As named, it explores new and exploratory developmental projects, frequently used for pilot studies, feasibility studies, proof of concept studies. Preliminary studies are actually discouraged. That doesn't mean if you don't have preliminary studies, you should leave that out necessarily. It all depends on what you think makes your case. But preliminary data are not necessary for an R21. The combined budget for these developmental projects is clearly lower than R01s, so usually it's a 2-year project and does not exceed $275,000 in direct costs, and it's up to 2 years of funding. I think that pretty much covers the details of the program, BRP, and some basic details about funding heuristics. And now Dr. Moser will be speaking.
All right, so thank you, Jerry, and good afternoon, everyone, or good morning, if the case may be. Again, this is Rick Moser, and I'm going to be talking, give you much more details about the FOA. And I thought the first thing I would want to do is kind of give you a little background and purpose, really kind of the why. Why did we kind of put this together? Why did we think this is an important area to study? And I'll start with saying that we're kind of in a new world here of open science and data sharing. And so all of you now have unprecedented access to existing data of different types. And so we really want to take advantage of this new research world that we're living in, and encourage researchers to merge and link these different types of data to perform what we're calling integrative data analysis, which is briefly defined as taking independent data sets, merging or linking them together, and analyzing them as a whole. We feel that through this integrative data methods, that we can do two things. We can actually, the goal is really to create a cumulative knowledge base by taking, again, different data, merging them together, and we really feel like this can really advance science more rapidly and get to those answers that we need to understand, especially in behavioral cancer control. So in many ways, we're kind of following along, if you're familiar with the moonshot, the cancer moonshot, same idea. They're trying to kind of advance research quickly, and really in some ways, this is part of that, doing this integrative data analysis. So maybe I'll just kind of emphasize, you can see the last bullet point here says the purpose of this PAR is to integrate two or more existing independent data sets to answer novel cancer control and prevention questions related to behavioral risk factors for cancer. So that really kind of summarizes it very nicely, and I will certainly emphasize that throughout my talk. But let's first kind of talk about the types of research opportunities that we imagine people might be submitting here. And again, this is not meant to be comprehensive, but just the ideas or some of the things that we were thinking of when we put this together. So for example, one of them might be to combine multiple retrospective cohorts. And so, it might be the situation that, so instead of asking you to go collect data over 20 or 30 years, perhaps there are cohort data that already exists, and perhaps there's a data set that, for kids, and a data set that has adolescent information, and one that has adults. And if we can hopefully figure out a way, and you guys can figure out a way to kind of string those together, so to speak, to extend kind of the reach and impact. And of course, we think that this is a very cost-effective way of doing research. And the good news is there are methods, analytic methods and otherwise, developed to help you do this. And typically, the idea is you have to at least have one common measure within each of your data sets in order to kind of concatenate them, if I can say that. But just know that that's something that we know has been done and we think would be a very good use of this funding mechanism. The second one might be to assess small populations. So these could be underrepresented or underserved groups. You see I give some examples here, whether it's LGBT, or maybe you want to find out more information about racial ethnic subgroups, Asian, Hispanic, or otherwise, that any one data set just wouldn't have enough subjects. So you would need to combine across several data sets that maybe have kind of a small number of subjects within each of these groups, but by combining them, you have enough statistical power to actually make some interesting comparisons of the different subgroups. We think that's kind of important. The third one I'll talk about is maybe studying rare cancers or rare events. For example, head and neck cancer, which are not very prevalent, but maybe across several data sets, you would have enough, again, subjects within each of whatever group of interest, thus that you could combine them and again be able to kind of look at estimates or look at predictors and whatever outcome of interest for these groups. And the last one I'll talk about kind of says combining across diverse data sources, this idea of cells to society. I'm sure you've probably heard that. So in many ways, we're really kind of talking about multi-level analyses, and we think that's one thing we want to support here as far as what would be responsive to this FOA, this funding opportunity announcement. So let's talk a little more about kind of the requirements. Really, I would consider these the criteria to be responsive to this FOA. So very importantly, the data should be from 2 or more data sets, and I probably should also include 2 or more independent data sets, different sources and types if possible or where it makes sense, and should include at least one source of behavioral data, which of course begs the question, what do we mean by behavioral data? So let me tell you about that. So we've kind of cast the net somewhat wide as far as what would fall under this idea of behavioral data. Probably most obvious one is observable behavior. Things like physical activity, diet and nutrition, medication adherence, for example, maybe vaccine uptake, tobacco use and screening. Again, these are observable behaviors. We're also very interested in other things like cognition, which would include things like knowledge, perceptions, attitudes, also affect or emotion, and then also the environment, which could be the built environment, could be exposures, could be other kind of geographic information system level variables, GIS. I'm sure most of you are very familiar with these kinds of things. Very importantly, we expect that you are going to use existing data sources rather than collect new data. We think that's kind of an important thing to mention. Again, this idea of hopefully that contributes to creating science that's very cost-effective and efficient. It is okay to reuse previously collected data or data from your colleagues. But I do want to kind of point out a couple of things. So, for example, it could be data from a previous grant if you were lucky enough to get a grant that could be repurposed. And I'm hoping, as I'm saying this, lights are going off in people's minds, like, oh my gosh, this would be great. I have this data, I collected it, I used it, but boy, there could be a second use for this. And then I mentioned something about high-quality pilot data. And I kind of emphasize the high-quality part here. So keep in mind, these are existing data sources. So if you're saying, hey, I'm going to use my data, I've already collected them, already have them, my colleague has them, et cetera, it's obviously going to be important that the reviewers understand, well, gee, where do these data come from? Were they kind of collected in kind of, with rigorous sound methods, these kinds of things? Did you use valid measures, these kinds of things? So that's probably something you would want to explain in your application, just so that the reviewers get really understand where these data are coming from. Again, since you're not collecting the new data and they can't review your methods for that, they would need to know how you collected the data to begin with. And the last thing I'll mention here is that the goal here is to answer a cancer-related behavioral research question that cannot be addressed with one data set alone. So again, it's something novel, new, that you couldn't answer with one data. I would have to combine, merge, link more than one data set in order to answer my research question. So given the fact that, again, we're asking people to combine different types of data, these kinds of things, the idea that we really do want to create a cumulative knowledge base here, we imagine that a lot of the proposals that will come through here will have a bit of a multidisciplinary or transdisciplinary approach. And I list here some examples of some of the disciplines we imagine would be the data would reflect that, or the people who are on the team would reflect these areas. This is not meant to be comprehensive. And I should mention that you don't have to involve a kind of multiple disciplines in your team or the type of data, and you certainly shouldn't do it just because you think it would be good, it would look good. You don't just include a geographer or somebody, behavioral economist, just because, gee, that would look good. Really should be driven, who's on your team, these kinds of things, the type of data that you'll be using clearly should really be coming from the focus of the research question. And what's the research question trying to answer? In order to do that, I would need these kinds of disciplines on my team, these kinds of data. So I just want to emphasize that. So of course, one thing that might be helpful is like, well, gee, what kind of research questions are we talking about here? So I just have two examples here. And as I was kind of getting ready for this, I realized, yeah, in some ways they're both kind of multi-level in some ways. So again, this is just two examples of many that you could probably come up with. But just hopefully give you kind of a flavor of the types of things we're asking for. You can see the first one is how do personal attitudes towards vaccination and sexual behavior measured by different groups, parents, adolescents, young adults. Also getting input from physician recommendations and accessibility to healthcare interact to influence HPV vaccination uptake. So you can see we have different types of data coming from different people, parents, children, physicians, those kinds of things. And you have a little bit of the multi-level aspect. Maybe you're kind of looking at accessibility to healthcare, so that could be kind of a built environment idea. You can see that the outcome is about HPV vaccination uptake, clearly a behavioral outcome, and certainly related to cancer control. And the second one is a little more general, but really kind of, again, multi-level. What kind of biological, self-report, environmental, policy factors explain trends in cancer incidence, mortality, inequalities? So you kind of get the idea there. Again, that's a little more clearly kind of a multi-level type of analysis. And what can be learned to inform behavioral interventions based on these data? I did want to emphasize, We're certainly not expecting people to do interventions, especially since this is all secondary data analysis. But again, maybe what you learned could be used to inform a behavioral intervention, to understand what works best in getting people to do physical activity, what works best to get people to eat better, what best explains why certain maybe racial ethnic subgroups have higher or lower levels of cancer. All right, so let's talk a little more kind of the administrative aspects here, talk about application deadlines. You can see it implores you at the very top, please read the funding opportunity announcements very carefully. And there's a little disclaimer under that, subject to change, always check the NIH guide. But for now, at least, you can kind of see, and Jerry mentioned this, so for both the R21 and the R01, we're going to have 2 submission cycles per year for 3 years. And you can see for each of these cycles, you can see the dates for those, and they're pretty consistent. They're slightly different for each one, but as far as consistent as far as the month, and pretty much when in the month you would submit that. So notice those. Of course, we've already received applications for cycle 1, but cycle 2 is not too far away in June. And I'm hoping that at least some of you on the phone here will be submitting applications for that June one. But if you missed that one, again, there's several opportunities in the future to submit. Underneath, you can see it says letters of intent are not required. So that's keep in mind. And very importantly, it says start the process early. Allow time for registration in the system for award management, ERA Commons, and grants.gov. If you have never submitted a grant before, those might be unfamiliar to you, but for those who have, those will be familiar. So, but I want to just mention a couple of things here. First of all, that to take advantage of the resources that are there to help you think about these things. So certainly, I, as the scientific contact here, scientific lead, can help you think through your ideas, your questions. Many people have already contacted me, and again, that's an important role that I serve, and I'll mention that a little more a bit later. If you did have other questions about kind of the administrative aspects of it, what's due when, how do I do this administratively, you'll see on the announcement, if you go to the website, if you go to the announcement on the website, you'll see the admin contact for that. I believe her name is Carol Perry, who works in the Office of Grant Administration, and she can help with kind of, again, all those administrative aspects. So I think I'm going to stop here. I'll come back in just a little bit to talk about resources, but I'm actually going to turn this over to our technical expert, Michelle Mollica.
Thanks very much, Rick. At this point, I'm going to present some examples of data resources that could be, or one could leverage to potentially be responsive to this funding opportunity announcement. So you'll see here and on the next few slides examples of several national and nationally representative surveys that could be used to propose questions within this FOA. In the interest of time, I'm just going to highlight a couple, but you will see that all of the websites are listed here, and there's lots of information on each of these resources within each website. One example of a relevant data resource is the National Longitudinal Study of Adolescent to Adult Health, and it is a longitudinal study of nationally representative sample of adolescents in grades 7 through 12. This survey collects social, environmental, behavioral, and biological data. Another example is BRFIS, which many of you may be familiar with, the Behavioral Risk Factor Surveillance System, which collects state data about U.S. residents regarding health-related risk behaviors, chronic health conditions, and use of preventive services. And the Medical Expenditure Panel Survey, or MEPS, is a set of large-scale surveys of families and individuals, their medical providers, and employers across the United States. MEPS is the most complete source of data on the cost and use of healthcare and health insurance coverage. Some other data resources include healthdata.gov, which includes clinical care provider quality information, nationwide health service provider directories, databases of consumer product data, and community health performance information, as well as the Health Measures Dataverse, which is a repository of data from self-reported patient assessments, including NIH-funded initiatives such as PROMISE, NIH Toolbox, NeuroQual, and AskMe. We have several examples of NCI-supported data, including the SEER Cancer Registry, which many of you may be familiar with, and HINTS, the Health Information National Trends Survey, which collects nationally representative data about the American public's use of cancer-related information. In addition, the Family Life Activity Sun, Health, and Eating, or FLASHE study, was sponsored by NCI and collected survey data on psychosocial, generational, and environmental correlates of cancer preventative behaviors. An important note here is that the cancer epidemiology cohorts, as well as the FLASHE study, require application and approval to obtain data. So please see the website for more information on this. And then finally, we have several FearLinked resources or data sources here at NCI. Within the Healthcare Delivery Research Program, we run some publicly accessible FearLinked resources, including SEER Medicare, which links the SEER Cancer Registry with Medicare claims for Medicare beneficiaries, the SEER MHOS, or SEER Medical Health Outcomes Survey data resource, which links the SEER Cancer Registry data with the Medicare Health Outcomes Survey. The MHOS survey provides information about the health-related quality of life of Medicare Advantage organization enrollees. And finally, the SEER CAPS, or SEER Consumer Assessment of Healthcare Providers and Systems Survey. SEER CAPS is a unique data resource. It links the SEER registry data with Medicare enrollment information, the Medicare CAPS survey, which is used to examine patient experiences, as well as Medicare claims for fee-for-service beneficiaries. All three of these data resources do require an application and approval as well to obtain data, and there's lots of resources and tips on the website for more details. At this point, I will turn it back over to Rick to discuss resources.
Thank you, Michelle. I think I clicked this is fine. All right, cool. So I did want to give you a little information about some resources that will help you with your application or to find out about other types of applications. So the first thing I want to mention, this is important, that today's webinar and the list of the frequently asked questions, both ones that were submitted before we did this and that will probably come in after the webinar, these will be posted online. You see the link there where you can find that information. I was told that information will probably be up in a couple of weeks at the latest. Also on that, you can also find links to different funding opportunity announcements and program director contact information. Here I'll stop and just remind you that there are many program directors within NCI and of course within any of the institutes across NIH that are there to help you with this exact process, submitting a grant. And we encourage program directors, we encourage you to contact us early in the process. Even if you just have an idea that you're just trying to bounce around and see if it makes sense, up through, of course, if you do get funded, then you work very closely with your program director after that. But as I mentioned earlier, I've had several people contact me about this specific funding announcement, and either they've just thrown out some ideas to me, or they sent me like a one-pager that I can review and just give some feedback on if they seem like they're kind of heading in the right direction or not. If you want to connect with any behavioral research program staff member, you see the link there. Again, that will be just anybody within our program, and you may find somebody who has kind of similar interests or kind of leading an area, and you may want to follow up with that person. And if you do have any questions or feedback or something like that you want to send to us, you can see the link for you to submit an email to the behavioral research program. Right before we get about ready to go to the questions, but before we get to that, just want to mention a couple other things. If you'd actually like to get email updates from us, in other words, you don't have to keep coming back to our website, but want to get regular updates, you can see the link there to subscribe, so you can get regular BRP email updates. And if you're involved in Twitter and want to follow the Behavioral Research Program on Twitter, you can see the handle there. I think I said handle correct. Is that the right term? I'm not much of a Twitterer, so anyhow, So again, a nice way for you to connect with us in the behavioral research program. All right, so let us now move to the Q&A section. What I'm going to do is I'm going to start with some questions that have already been submitted that will be of general interest to everybody here. And so let me kind of, again, hopefully we can address some of the questions that already may be in your head as far as this funding announcement and how to work with it. Okay, one question is, are new applicants who have not had prior NIH funding before encouraged to apply? And the quick answer to that is certainly yes. We do welcome applications from new and early stage investigators. Of course, those of you who have already obtained a grant, of course we want you to apply again if you're interested. However, if you are new to the NIH application process, we strongly encourage you to consider working with someone who has experience with the NIH grants process before. So that may be a colleague, maybe somebody, an expert at your institute, can help you kind of guide you through the process. It's you know, as you know, it's fairly complicated. But I also reiterate, use program directors as people who can help you with the kind of scientific aspects of your application. Or again, if you have more administrative concerns or questions, there should be kind of a person listed on the funding announcement to contact about those. Are these applications being reviewed by a special emphasis panel? And the quick answer to that is yes. As Jerry mentioned earlier, this is a PAR, so all applications will be reviewed by a special emphasis panel that is convened specifically for this initiative. They will have expertise across many areas, certainly in behavioral research, behavioral methods. Just general methods, I think, will be very useful. Obviously, people who have interest or expertise in cancer-related research, but I'm also thinking that it would be very useful to have people, let's say, who have kind of geographic backgrounds, given that I imagine people will be using those types of variables. So I will be working with the scientific review officer to do my best to make sure that we do kind of a variety of experts on the panel, on the review panel, to reflect the types of applications I imagine we'll receive here. Question, why are the standard NIH receipt dates not included for this application? Basically because the application is going to a special review panel rather than a standing study section. Thus, we set kind of our own receipt dates for this program announcement. Again, the 2 per year for 3 years. So I just want to mention that. Are there any special conditions for international applicants? So the answer for that is, for all NIH grants, funding international applicants does require some kind of justification of why the work needs to be conducted abroad. Now, given this is secondary data analysis, that may be a little trickier to do than if you were collecting your own data, but perhaps maybe the data that you want to use are only available internationally, something like that. So clearly, there could be a reason to do that, but you would have to have a good justification for that. Maybe the last one I'll do, then we'll look to see if we've got some new ones here. Are there limits on available funds, or is there a set number of grants that can be funded under this opportunity? The answer for that is there are no specific limits set. There are no specific limits set for this funding opportunity. The limitations will be based on how well the applications score in the review process. And the receipt dates for the special review are different from the standard receipt dates. So please read the funding opportunity announcement carefully. I just want to reiterate that. Okay, so maybe now we'll kind of look to see what questions. Oh, actually, sorry, I do have one more before we get to these. And this kind of had come through earlier, and I think this will be of interest to many people on the phone here. One question came up with, can an application just be specifically methods focused, really just on the methods itself? Or in other words, does it have to be kind of a balance between kind of methods and outcomes, or these kinds of things? And the answer is, it should not just be methods itself. In other words, it shouldn't be just, well, we're creating this cool new method to combine, link, merge data, and that's kind of the focus of it. If that's the case, there are actually other funding announcements that I think would probably be better fit for this. There has to be some kind of cancer control research question that you're trying to answer that can only be answered, as I said earlier, through merging, linking these multiple sets of data. So again, it has to be a balance, but I do imagine some of the methods will be part of your application. You're creating something new, you're trying something novel as far as merging or linking, but again, it has to be in support of answering some type of research question. Okay, now I'm going to kind of turn to see kind of questions. Okay. So the first question I'm kind of looking at says, do the data sets have to be using validated instruments? Now, validated, of course, can be many things, but I think the quick answer would be yes, in the sense that these should be rigorous, sound measures of whatever you're measuring. There should be some kind of something to show, yes, this isn't something we just made up, but has been kind of tested, validated, used before. In some ways, as I mentioned earlier, since this is all secondary data analysis, you will need to kind of spell out a little bit about where the data came from, how they were collected, how the instruments, were validated, these kinds of things, so the reviewer can really say, oh yes, these are, okay, yes, I get this, this makes sense, and I can see how this would be a good, rigorous research project. One question we have here is, you mentioned the CERCAPS linked database. To be responsive, is this linkage enough, or would a third database need to be linked merged?
Yeah, so I'm happy to answer that for you, Rick. Because CERCAPS is made up of multiple resources already linked together, it actually would be considered responsive to this FOA.
Exactly right. One question says, is it preferred to conduct longitudinal studies or cross-sectional studies that are linked? I don't think we have a preference here. It's all about the research question you're trying to answer. Is it novel, and does it kind of make an impact? Is this going to make an impact on cancer control research and those kinds of things? So no preference per se. We have a question here. Since you have cast a broad net to define behavior, would healthcare-seeking behavior and cancer screening fit in your definition of behavior? And the answer to that would be yes. Again, it is kind of broad as far as our definition here, cancer-seeking behavior, these kinds of things. Screening, as I mentioned earlier, I mean, to me that's a observable behavior. Do you get screened or not? Would certainly fit.
And I will just add, Rick, that CERCAPS has that information in Medicare claims. So healthcare utilization or Fear Medicare, there's some limitations to that data, but the website has more information about that.
Awesome, thank you. Let's see here. So one question says, how big would the data set need to be? Would small data sets less than 500 be considered? So again, I can't think of any restrictions on how many subjects you need to have in a data set. It really comes down to what question you're trying to answer and how can you do that. If you have enough people in your study, whatever you're studying, and you can kind of show yes, you may need to have maybe a power analysis to show yes, through this number of people, through this analysis we're doing, we have enough power to detect differences in our groups or something like that. So you probably at least want to provide some rationale as far as if it seems like there might be some concern or questions about do you have kind of enough subjects, enough statistical power. That's where I keep thinking about what that relates to. So one other question, is the merge necessary at the individual level, such as between SEER and Medicare, or could the link be time, for example, day-to-day social media data and annual health survey data? Oh, that's interesting. So I don't know, Michelle, if you had any thoughts here. One quick thought is that no, it does not have to be at the individual level. Again, I keep probably sounding a little bit like a broken record here, but it kind of comes down to what's the question you're trying to answer. And so as long as your methods fit with what question you're trying to answer, that's what's most important.
Sure. So there's one question that came in. Does the CERCAPS data have variables on cancer stage and cancer treatment types. So we do have cancer stage through SEER. We have some cancer treatment through Medicare claims, but our website has lots of information about the nuances of that.
Right. I see a question here. It says, you mentioned it is all right to utilize previously collected data by colleagues. What if the investigators also contributed to this data collection in the past? Should the previous data be completely new to the applicants? So the answer is not a problem. The previous data do not need to be completely new to the applicant. As I was saying, you can actually repurpose data that you used in a previous grant. Again, obviously, maybe it's not obvious, but clearly you're going to have to ask a new question that you didn't answer in the previous grant. So it's going to have to be, again, a novel research question, but otherwise, that's not a problem. So one question is, can you look at just one behavior, for example, breast cancer screening with its multi-level determinants, or do you have to examine multiple risk behaviors? So that's a good question. My answer to that is no, it does not have to be multiple risk behaviors. I think I gave you some examples before where the outcomes were HPV, uptake, those kinds of things. That's just one behavior, but it's really kind of the what predicts that, what best explains it, which is kind of the kind of multi-variable aspect of it. Again, taking different types of data to understand HPV uptake, or in this case, breast cancer screening. So one other question says, what if you had behavioral data on subjects and related specimens that have not been analyzed yet? Would analyzing the specimens and linking them to the survey data work? Yes, not a problem. I think that could be a nice, actually, good example where you're taking some existing data, but really enhancing it by taking new data, linking it to it, whatever the case may be. So that seems very responsive. So that looks like maybe all the questions we have for now.
So you can continue to submit questions to the email address on your screen here if you have any follow-up questions. Sorry, the email at the bottom there, that's the right link. So you can, if you have questions following today's webinar, you can submit them to that email address. They will also be available online the next couple weeks underneath this website that you see here, along with the recording of today's webinar. With that, I'd like to thank you to all of our panelists in the audience today for a great conversation. As I mentioned, the presentation and Q&A will be posted online at a later date. And please also take a moment to complete the short 5-question survey following today's webinar, and we would greatly appreciate your feedback. Thank you again for your participation.